Good evening, everyone. Chief Tonya Perron here. I hope everyone is doing well and hanging in there. So I know this hasn't been a very easy year. So what I'm going to tell you makes it all the more difficult to do, especially since we're so close to Christmas time. Unfortunately, as the Assistant Grand Chief, it's my responsibility to provide these messages, however, to the community. So following a meeting today with Public Safety Commission and the Public Health, and in accordance with Section 10 of the Emergency Preparedness Law, a state of emergency has once again been declared. This was a unanimous decision that was made by the Commissioner of Public Safety, myself, as well as the Executive Director of the Mohawk Council of Kahnawake. And as I said, it's in accordance with the Emergency Preparedness Law. The rapidly changing situation in the community is not something to be taken lightly. Our numbers have doubled over the day since yesterday within a 24-hour period. It is nearly impossible to contact trace. The projections for the next week are quite alarming. And there's very serious concern that our essential services could be significantly impacted by this recent wave and this very rapid increase in the number of positive cases within the community. So just so that everyone knows, this declaration, which is actually a decree, will be ratified tomorrow at the emergency council meeting that's been called. We understand that this is not where anyone wanted to be at this time. We ask everybody to remain strong and persevere. We will get through this. Aside from that, I wish everyone a safe and much needed holiday. I hope to see everybody in the new year and outside of a state of emergency back into the state of recovery. With that, I will turn it over to Lisa and then to Lloyd to fill you in on some further details and directives. So now we'll go everyone for listening, and have yourself a good evening.
Thank you. Unfortunately, we aren't able to hear Tonya speak here in the room, so if I do repeat anything that Tonya has already said, I'm sorry about that. So we're here again today, third time since we had wished you all Merry Christmas. It's difficult being here today, to be honest. I guess what we want to be is as honest as possible, as realistic as possible, as supportive as possible. We don't want to create mass panic, but we want you to have all of the information as up to date as possible. So what we know is that Omicron is now accounting for 80% of new cases across Quebec. We feel that this is the case here in Kahnawake as well. Although the labs have not given us confirmation of Omicron cases here in Kahnawake, based on the rapid increase in new cases in the last 24 hours, we can make the assumption that we do have Omicron in the community. So we know that the labs are not processing as quickly as they need to. So again, 80% of all new cases are related to Omicron. This is an increase from 30 to 40% just a day ago. So the numbers are really increasing very, very rapidly. Over the last 24 hours, we've had 21 new cases identified. This is added on to the numbers that we already had. So 21 new cases all in the last 24 hours. We are still awaiting results for 15 tests from yesterday. As you know, the labs are delayed, so we're still waiting on tests. And we also know that we've received many phone calls today of people who have done rapid tests and who have received positive results on their rapid tests, but are unable to find an appointment for a PCR. So we can conclude with this information that 21 is probably a lower estimate of the number of cases we have in the community at this particular time. 21 plus the 16 from yesterday, plus those that are not identified by a PCR currently. So this is a sharp increase which has led us to the change in status to a state of emergency, as was just explained, and will lead to also some changes in some of the measures that we have in place. And we will continue to monitor hourly as these changes progress and as we see the impacts in the community, so that we can try to curtail as much as possible. So the honest part is that we can't stop this wave from happening. We are going to see huge increases in numbers. As we had expected, cases are doubling every 2 days and sometimes even more quickly. So we are going to have a lot of increase in cases. And we have several objectives that are really, really important right now that we all have to think about. And it's how we can lessen the impact of all of these cases happening within the community. How do we have the least amount of impact possible? First, we need to protect our organizations. We have to be able to continue to give services to our community members, whether it be ambulance, whether it be transport, whether it be PKs, whether it be hospital, whether it be KSCS. I'm just naming a few, but all of the services that we provide, essential services, are extremely important to maintain. With this rapid increase in cases, we can see whole organizations wiped out in a matter of days, wiped out of resources, meaning people being in isolation. And we have to be really, really careful that we don't get to that point, so that we can continue to offer care to people who require it. We also want to lessen the impact to our community members. So although we have many people with positive results, it's the most vulnerable that we have to continue to protect. And in order to do that, we have to lessen our contacts as much as possible. And you'll see that some of the measures that we are going to present to you are, again, a means of decreasing those contacts, but we all have individual responsibilities to stay as close to home as possible to limit our contacts as much as possible. Last thing that I want to talk about are the rapid tests. So rapid tests were added as an extra precautionary measure to allow us to make important decisions about safety for ourselves. So it gives us independence, autonomy to make those decisions. However, it's also created a lot of confusion. So I just want to dispel some of that confusion and explain a little bit about what you need to do with your results of your rapid tests. So, rapid tests are not as accurate as a PCR test. We've spoken about that before. But what we do know is that the specificity, so the accuracy of the result, of a positive result, we can count on it. So if you have a positive result, then you can assume that your result is positive and you need to isolate. Of course, it would be great to validate that test result with a PCR, but considering the long lineups at the many testing sites across Quebec and all the ones that we're used to using, it's really difficult to get in. So what we're asking is that if you have a positive result from a rapid test, that you self-isolate, and everybody who lives in your household self-isolates. That is really, really important. Of course, try to get a PCR test. If you can, we'll accommodate. But the most important aspect is to isolate and to advise all of the contacts that you've had within the last 48 hours so that they know that they were a contact of a positive case as well. Again, responsibility on each of us to do our part, and because our system cannot make up for the sharp increase in cases, and we won't be able to contact everybody. Next, if your rapid test result is negative, these negative results are only 30%, 30 to 50% accurate, depending on when they're done and whether you have symptoms or not. Therefore, if you have symptoms and you do a negative and you get a negative result on a rapid test, you must stay in isolation. And if your symptoms persist, you should do a PCR test. If your symptoms go away, then you can consider your result negative. So we're asking that you stay in isolation as long as you have any type of COVID-related symptoms. This is the best way for us to curtail transmission at the current moment. So again, a positive rapid test, you should go into isolation. Your household should go into isolation, and any of your direct contacts. So remember, a contact is over 10 minutes within 2 meters without a mask. That's considered a high-risk contact, and therefore your contacts should be in isolation. If you're negative and you have symptoms, you should stay in isolation, and if your symptoms persist, then you would redo the test or redo a PCR is what's best. What we're seeing happening is very confusing as well, is the letters that we're sending you from public health. So if you are a positive case, if you remember we spoke about this yesterday, if you're a positive case, you're going to get contacted by public health, but your contacts, we're going to ask you to give your contacts a letter. In that letter, it explains all the different scenarios. We know it's confusing. So if you can, and we know that if you're a contact of a positive case, you should be in isolation. So remember everything you know, everything we learned. I know it's changed a lot over the 2 years, but the main thing to keep in mind, and we'll release this tomorrow, if you're a contact of a positive case, so more than 10 minutes within 2 meters, you're not wearing masks, then you need to isolate. If you live in the same house as someone who's positive, then you need to isolate. Those are main points that you need to keep in mind. The second main point is that you want to limit your contacts as much as possible. So with the holidays coming, we can expect we continue to expect increase in cases because we're not going to be able to suppress completely the sharp rise. So I don't know how to explain it, but without any measures, our numbers are going to just go straight up in a straight up line, and a percentage of those cases are going to end up with hospitalization or more severe illness. So what we're trying to do is kind of put a stopper in there, like a little buffer, with the measures we have in place, with what Lloyd will speak to you about, with the state of emergency, with our call out to all of you to be cautious. This is a buffer to try to make the increase. We won't stop that increase, but if it happens over a slower period of time, then we have a better chance of saving our organizations, our frontline staff, our residences, and the staff that take care of those who live in our residences, and we also have a better chance of protecting our community members who are most vulnerable from severe illness and potentially hospitalization. We have several outbreaks right now in the community, in different areas, in different businesses, in different locations. We have several phone calls. That's important to know. So really, each of us taking care of ourselves, of our loved ones, of our family is most important. And the best way to do that is to follow all the measures that you already know about. Always keep a mask on. So if you're using those rapid tests to define a gathering and you're asking yourselves or saying to yourselves, well, we've all tested negative with a rapid test, we don't need masks. That is not the truth. So anytime you're gathering with people outside of your household, even if you've had a negative rapid test, you should be wearing masks and you should keep distances within your gathering. That is most important if you want to be sure to protect, especially those who are vulnerable. I think that's the information that we wanted to provide to you today. Lloyd's going to speak about some changes in directives or measures in order to assist with the decrease in contacts within the community. But we just want to really be supportive in the sense that the number of cases is no longer an indication necessarily of where we're at. It's how we're acting as individuals in terms of protecting ourselves and others, making sure that if we have symptoms, that we test, that we isolate, making sure that we're doing everything we can individually to kind of protect the collective. Again, we're kind of going backwards a little bit, except for the only difference now is that we have so much more information and knowledge, and we're able to do this together as a team. So I'm gonna pass it to Lloyd, and I wish you all really a Merry Christmas. With your family, with those who are close to you. We hope that that we will be able to celebrate in a way that's meaningful, and that is also up to us as individuals. What's meaningful to us and how we make that happen is part of the, I guess, part of the learning that we're doing on a day-to-day basis. So we'll probably see you again one more time before Christmas. So I'll pass it to Lloyd.
Thank you, Lisa. Thank you, Tonya. Yeah, so as I guess we all know now, I mean, the past 48 hours have seen the situation evolve very rapidly within our community, first and foremost, but also what's happening, around us throughout the province and throughout Canada. And as a result, as was mentioned, after some discussion this afternoon, it was decided that we do have to once again declare a state of emergency, which came into effect this afternoon. And this will be, again, formalized by MCR tomorrow by the elected council. The reason why we had to declare a state of emergency is obviously a lot of information that Lisa just raised in terms of the large number of cases and the single highest cases of COVID we've seen in a day since the beginning of the pandemic, and the trajectory in which we see the numbers going, and also the ability for us to properly respond. Throughout the state of recovery since June, we've been gradually reducing measures, releasing different directives, and allowing for more freedoms, for lack of a better word, for community members. But as we've seen recently, we had to put a pause on certain areas. We had to institute a few things to try to keep us on that path to recovery. But in the past few days, it became obvious that we are no longer trying to, at this point in time, trying to move towards that state of normalcy, that we are now unfortunately dealing with an emergency, and we are in the position of response. So in order for us to respond, and in order for us to clarify roles, responsibilities, and allocate resources where appropriate, a state of emergency needed to be declared. And that, again, like I said, was done this afternoon. We're hopeful with the measures previous announced and the new measures that I'll speak of in a minute. We will be able to put enough buffers in place so that we slow the spread of the virus, within our community. So with that said, a couple of things will be taking place in the very short term. What we announced yesterday on our measures, or recently as well, a lot of it has been modified. Bars and social clubs in the community will be closing effective tomorrow. Arnold Lazar was contacting most of these people who are impacted directly today, so they are aware. Restaurants, in-room dining, as of December 24th, Christmas Eve. Afterwards, they will be closing for in-house dining, and that will be only for pickup and delivery. And initially, we're looking at this for a 2-week period, and we'll have to assess as we go. Also, that also includes is also the cigar lounges are also be closing as of tomorrow as well. I know there was a lot of questions about manufacturing and retail. So what has been discussed at this point when it comes to manufacturing? I know there's manufacturing in the community. There's obviously tobacco is a big part, but there's also other manufacturing in the community. What we're at this point in time is formulating a recommendation that you reduce your workforce by 50%. If that means capacity issues or night shifts or different shifting, split shifting, or whatever it is in terms of a management perspective, we recommend that. The less people at one point together, the better. And as well as reinforcing what we did when we first reopened. The masks, distancing, plexiglass, and the hygiene processes should be done stringently. And at this point, it is a very strong recommendation, and we'll assess again as things go forward. For retail, across the board, what type of retail you're in, we previously mentioned about ensuring distancing, and minimizing the capacity within your areas, but there is no plan at this point to close any retail industries. What we are focusing on is areas where people gather and where people will be in one location for an extended period of time. Whereas in most cases, retail people are in and out, and so the risk is less. Although the risk is never zero, but there is less risk. But versus where you do have areas where you're sitting or together with other individuals. We know some of the like for example, as of we speak today, anyways, in Quebec, that they are maintaining restaurants to be open. They may change that in the future, but after careful consideration and looking at the Omicron and the numbers. And the high percentage of Omicron, that we feel that restaurants, are not going to be a safe place. And so again, we want to be proactive in Kahnawake and take the necessary measures to prevent mass transmission in our community, but also around us as well. Because Omicron, as I said, was aerosolized, and whereas before, the spread of the virus was limited when people were speaking. We used to talk about 6-foot distancing and so on, that after 6 feet or thereabouts, you're relatively safe because the droplets fall to the floor, and the risk is much less. Now, to draw a parallel, it's more similar to smoke. If somebody lights a cigarette at one side of the room, and it gradually flows, the people closest to you within a few feet will smell that smoke almost immediately, and then the people 10 feet will gradually smell it, but eventually, the entire room will smell like that cigarette smoke. So that is similar, to the way the Omicron has been spreading. So the distancing and stuff, are not nearly as effective as they used to be. So I just want to try that little parallel for individuals out there. I mean, and it may not be the most scientific example, it may not be 100% accurate, but I think for a layman's terms, I think that's one of the best ways that I could explain it to individuals. No, we've been doing this job for a long time. Our community has been putting up with a lot, since the beginning of the pandemic. Staff on many fronts. Frontline workers, health workers, public safety workers, essential service, emergency workers have been doing a lot, and they will continue. And as it was mentioned already, we are concerned at the rate of spread of this virus, this variant, that we could jeopardize essential services. That's why we need to take these actions as one step. But again, it's up to individuals to take all the tools and put them into place and be as safe as possible. There has been times throughout the pandemic that I have had serious concerns, obviously concern throughout, but there has been times where kind of peaks and valleys where there is larger areas of concern. And now here is another one of those peaks. I am concerned. for our community, and that's why we have declared a state of emergency. That's why we have had several Facebook Lives. That's why we are continuing to monitor the situation very closely. That's why we feel areas of gatherings have to be greatly restricted. That's why we have rapid tests being distributed throughout our entire community and such, because there is that level of concern. Certainly, we're not at a point where I want to put fear or I want to put panic, but it certainly is a concern. And the only way we will continue to keep a level of control on the trajectory within our community is, again, with everybody's cooperation. Because without the cooperation of the community as a whole, the job for public safety and public health is going to be futile. So we look to you as Kahnawà and everybody's collective responsibility to ensure that we do our best to keep each other safe, and we will keep you up to date. We will keep speaking to you on a regular basis. We will have a show again in the next couple of days to provide additional information, prior to the holiday season. And as I said last time, nobody wanted to be here. The situation, is not good, and we always want to sometimes throw our hands in the air and say, what's the point? But the point is keeping the young ones safe and keeping our elders safe and keeping all of us safe. So with that, Talk to you soon.